terribly and systematically misled in this country for some time, and I did part of that misleading.
You know, you've looked at the evidence.
There is real science now out there.
He was flat out wrong about
the science
weed.
is there. This isn't anecdotal. This isn't in the realm of conjecture anymore. I mean, for a long time we've just ignored these papers, but this was a drug, you know, that was used for thousands of years.
Well, this medicine could work. Teresa Pointer was diagnosed with MS in February of 2004. For years, she struggled with pain and exhaustion. She tried just about everything, but found the drugs prescribed to her were either ineffective or had awful side effects. Then one day in 2005, she read in the newspaper about clinical trials for a marijuana-based medicine.
Have you ever tried cannabis? I mean, what were your thoughts on it?
No. No, I mean, ever since I was a little girl, my mum had always said to me, you know, don't do drugs, don't do drugs.
But nearly wheelchair-bound, Teresa was desperate. She tried it, a spray to the back of her throat several times a day, even once during our interview. Her pain and muscle spasms are now well controlled.
So just the relief to be able to have a couple of sprays before I go to bed and feel comfortable enough to just go to sleep.
2 points. First of all, these other medications that we talk about for pain, for example, morphine, Dilaudid, OxyContin, Vicodin, you name it. Every 19 minutes in this country, Piers, in the United States, someone dies of an accidental prescription drug overdose. This is no joke. Every 19 minutes. As we investigated this, I couldn't find one documented case of someone dying of a marijuana overdose.
I'm Dr. Alan Shackelford. What you will see in this brief presentation is remarkable. It's unlike anything that I, in my 30 years of medical practice, have experienced, and it's based on medical marijuana. You may have preconceived notions about what that means, but please watch the next few minutes with an open mind. I think you'll be astonished.
So Charlotte has Dravet syndrome. It's a severe pediatric epilepsy. The seizures when they start with Dravet are status. They don't stop on their own, so they're 20 minutes or 30 minutes or longer. I think her first one was about a half hour. Every seizure after that for 2.5 years was a status seizure, and some were 4 hours long, 2 hours long, and you know, at that point she's intubated in the ER, in the pediatric ICU. And medicine doesn't stop them, so that's, we went through that for about 2.5 years. We got diagnosed at 2.5 years old. A few times her heart has stopped during these, using these drugs, and I've done CPR on her, and a couple of those times, you know, I just sort of let go of the fact that just to keep trying with her, and I said my goodbyes to her, and as I'm doing CPR on her, or in the hospital, kind of prepared myself for the worst, and she's still here, but she's been through a lot to get to this point. The doctor, you know, she heard her history of seizures at that time and said, we have to pull this, her last med that she was on. Her exact words, we have reached the end of the line with medical options for Charlotte. And I don't know what to tell you, there's really nothing else we can do. And that's when we met the Stanleys, and that's when we got started on the CBD. After 6 months of, I really didn't think she would survive the seizures, 300 seizures a week, roughly. Of, you know, grand mal tonic-clonic seizures a week. Just to put in light what 300 a week is, it's about 4 an hour. It's one seizure every 15 minutes. So, you know, sometimes it was every 5 minutes. It just never stopped. And so to see her seizure-free for 7 days, she went 7 days instantly. And we've been on it 9 months, and from that 300 seizures a week, she now has 0 to 1 tonic-clonic a week. And so it's greater than 99% seizure reduction. and it's amazing. It's just absolutely amazing.
And that's key. The current potent epilepsy drugs impact many parts of the brain, including the brainstem. They can essentially shut off the body's vital functions if you take too much. Marijuana does not do that.
I took massive doses of it for 5 days, and for the first time in a month was able to get out of bed, walk, talk, think clearly. The lupus symptoms started to disappear the more I took the RSO for the cancer. The tumors started to shrink and disappear. I started to feel better. I stopped vomiting all the time. A lot of lupus symptoms started to just go away. Fibromyalgia, chronic fatigue I'm still dealing with, but the fibromyalgia is mostly gone. The chronic pain is mostly gone. As you probably know, cancer is the silent disease. You don't feel the pain unless it's somewhere where it's pressing on a nerve. I had tumors in my spine. I had tumors throughout my body. I'm supposed to be dead, people. I'm here because complete strangers were willing to buck the system and share the truth. And the true reality is, while my sister was going through 2 rounds of chemo and having both of her breasts removed, and the doctors feel sure the cancer will come back yet a 3rd time, without a doctor, without surgery, without chemotherapy, I am not only beating cancer, but I'm retrieving my life that was stolen by lupus. I've had over 40 mini strokes because of lupus. I've had a heart attack, and I'm prone to seizures. I should be dead. I'm not because of the kindness.
I was taking 27 different pharmaceuticals. I was on an intravenous morphine pump, and most of my medication was administered intravenously. I was basically a vegetable. I had a colostomy, I had a catheter, I couldn't go to the bathroom by myself, I couldn't shower by myself. By using alternative treatments with cannabis oils, cannabis juices, within 90 days, I was not only able to walk and talk again, but I'm working full-time and have a number of companies that I work with and represent in developing products to treat cancer patients.
So can I ask for,
from
that's
a
amazing.
scientific perspective, can you explain to the average listener how cannabinoid oil works?
If you develop a tumor and all of these cancer cells, then you take a cannabinoid supplement. Then these cannabinoids go and in the circulation and mate with these receptors of the cancer cells, which produces a flood of ceramide. Now, because the DNA of cancer cells is distorted, it's damaged, the ceramide senses this and knows that this cell is dying. And the job of ceramide in the normal body is to kill damaged and dying cells. So it senses that the cancer cell is abnormal and knows that it needs to die. And so that's why this increase in number of receptors on the cancer cell. So when the additional cannabinoids reach the cancer cell, it locks into it, sends the ceramide out to destroy the mitochondria, which starves the cell to get together.
Amazing.
It is an amazing process.
It is a potentially very effective medicine that has not been given a fair shake for 70 years in this country. I think it can treat things that other medicines that exist now that are far more dangerous, far more toxic, lead to far more deaths, cannot treat. It's bizarre to me, quite frankly. I think it's inhumane to these patients who can't.
Dozens of major studies have been published in the last few years that indicate that the chemicals in cannabis, in the lab and in animals, have a significant effect on fighting almost all major cancers, including brain, breast, prostate, lung, thyroid, colon, skin, pituitary, melanoma, and leukemia cancers. They do this by promoting the death of cancer cells that have forgotten how to die, as well as a reduction in their crucial blood supply, while leaving healthy cells untouched.
That drug is a godsend in treating a variety of diseases. 2-year-old Cash Hyde was diagnosed last year with a stage 4 brain tumor.
But his father said to me, when your child is dying of cancer, you'll do anything you can to help.
His choice defied doctors, but he says saved Cashy's life.
My name is David Esparza. I have had Parkinson's for approximately 13 years. I was diagnosed about 13 years ago. A neurologist that I was seeing, because really I was telling the neurologist that I really didn't want to take medicines. That, you know, I was in really good condition, and at the time I was playing and coaching handball, and I told her I didn't really want to take drugs. That, you know, I didn't want to take the medicines. And she told me about spraying marijuana. Helps me deal with my new life of 13 years. It helps me. I don't know what effect it has on other people, but it helps me tremendously. It just gets me with a different attitude. Next thing you know, I find myself in the garden, or I find myself, you know, making a tree house for my son, or I find myself playing with the dogs. So it really helps me to have an attitude, a good attitude, I think, about myself. And whether, you know, I don't know how I look to other people or what I look like on the other side of the lens there, but I know what I feel like in my head. I feel good.
I wish the city council could see this right here. Look at this, I feel bright. Look at that. I mean, come on, right now I am completely stopped. It's like, you know what my mother.
New Harvard studies that it's a miracle plant. It is proving to to cure cancer. It's stopping lung tumors from growing, things that they can't stop or treat with chemotherapy, they're able to treat with marijuana.